Hi, I'm Edmund, and over the next few minutes, I want to show you something that started as a data problem and we turn it into something that pharmacists can actually use. So here's the problem. Globally, only half of the patients on long-term medication actually take them as prescribed. Half. And at Woodlands hospitals, like most hospitals, the response to that has been reactive. We notice someone has stopped coming for their refill, and then we try to chase them down. We took 19 months of Woodland Hospital data and split it into two. The first 12 months, that's where we learn everything about the patient, their behavior, their history, their patterns. The next 7 months, that's where we did ask, did they stay adherence? Those two windows never touch. No data leads across that line. And then, how do you actually measure whether someone is adherent to the medications? We use PDC, the proportion of day covered. It is simple. If a patient has medication available on 80% or more of the days in the period, they are adherent. So look at patient A here. 3 refills overlapping nicely. PDC of 100%. And now patient B, same number of fills, but there are 44 days gap, 49 days gap in between. PDC of 50%. That patient is quietly falling through the cracks, and our model job is to predict them before those gaps appear. Now, we ran 7 models head-to-head on 14,579 patients. Gradient Boost model came out on top with test AUC above 0.81. So what does the model actually pick up on? Two things consistently rise to the top. How long a patient has been observed on each drug. Patients with the longer monitoring history are far more likely to stay adherent, and how long they have been in the dispensing system overall. The longer they have been engaged, the more committed that tends to be. And the EBN found something even more interesting. These two factors amplify each other, duration and the depth of engagement, aren't just additive, but they are compound. So drilling into general meds by drug class tells us even a sharper story. So anti-gout medication is at the bottom, 56.4%, and it made clinical sense because for gout attacks, patients felt completely fine, so they stopped taking the medication. Anti-epileptic at 65.5% are the highest risk group because missing a dose of anti-epileptic isn't just a gap in the spreadsheet, it can trigger a seizures. So these are the patients who cannot afford to fall through the cracks. And now they don't have to with our prediction model. Now I'll show you how the demo actually works in practice. So this is a pre-installed apps in the local PC. So the pharmacist just need to open out the app and then they click the upload to import in the data that is pre-exported from NHIP system, our dispensing data. And within a few seconds, the app has already logged out the dashboard. Okay, so if the dispensing data contains multiple patients, the pharmacist can toggle across the list of multiple patients and select the patients of the interest. So in the example of this patient ID 13600, you can actually see that this patient is on 6 chronic medication and none of the chronic medication is being adhered at the moment. So the historical PDC is standing at around 59.2%. The predicted future adherence is at 35.1%. So the future risk here is actually quite high, right? So across the 6 chronic medication, we actually rank it from the lowest adherence PDC score to the highest. So if you look at it, amlodipine is at the highest risk currently, right? It's the least adhered drug, followed by Durores, okay, and subsequently to quetiapine. So over here, the pharmacist can actually inspect the raw data that is imported, right, to the apps. Okay, they also get the explanation of the EBN, right? If they hover over, they can see the positive driver and what it means in the legend, right? And the red color is the negative driver that is pulling down the adherence score. So the same thing with cat boost sharp graph, right? So we actually have a legend explaining how each of this is impacting the scoring, right? And there's also a help guide to explain how to use this chart. So if the pharmacist just want a quick overview of understanding how the 35% is being derived, they can also click this button, why this scoring. right? It will bring them to the explanation, explanation and summary of the top drivers. Yeah, over here they can also look at the patient specific features value, right? So for instance, this patient is 48 years old, the patient is Chinese, and there is a total of 268 dispensers that is attribute to this scoring. And the good news is this doesn't require a big IT project to get started. Phase 1, which is the Streamlit app, is already ready right now. So we just need export from the NHIPS data, upload into the apps, and we get our result instantaneously. There's no integration, no waiting for the system approval. So in phase 2, we plan to connect it directly into our Hospital Helix platform for an integrated workflow with our NHIPS system. Okay, so this is currently work in progress. Thank you very much for listening.